the first thing that is important, as I mentioned before, is that in the long term, in the 76-week analysis, we keep the efficacy, or the drug is able to keep the efficacy that was reported before. That's, as I said before. And this is very important because we are not talking about just maintaining the patients, for example, in those that are SOC treated, that are treated with or that were treated before entering the study with the standard of care. These patients, a significant proportion of them, over 50% or around 50%, improved beyond their previous status. And this improvement is not transient. It's maintained over a very significant time point. That's the first thing. And this is probably the main population of CIDP. The second highlight is the refractory patients. So refractory patients are a specifically challenging population because these are patients that have not responded well to currently available therapies. And in the initial study, in the initial part of the analysis, in the 24-week, there was approximately a 50% improvement according to their baseline status of CIDP. And again, this, to a large extent, although there are some data that still upcoming, but to a large extent, this is also maintained, and this is also an important number to keep in mind because it's a challenging population. So around 80% with the data we have, but it could be more because there are data still upcoming, maintain a response that they had before. And the same thing for the naive population, which is not that challenging, is kind of the standard population, but it's along the lines or even better than some of the, let's say, standard of care therapies when they were tested at that moment. So that's like about the trial results. If we give an overview of the subgroup analysis, the other good thing is that this happens regardless of the, let's say, subtype of CIDP or the subgroups that we made of CIDP. So it's working similarly in all the subgroups that we can divide. It doesn't matter if it's age, the type of CIDP, time since diagnosis, etc. And then the other thing is that you mentioned the exploratory analysis, and the other thing that is important is that this was an open-label study, or it is an open-label study, but it has a very important biomarker that is neurofilament light chain. That is a biomarker that even if it is an open-label, it helps us anchor these improvements that we see in the trial, or these results that we see in the trial. It helps us anchor them to an objective biomarker, which is the neurofilament light, that is independent of any placebo effect or any other, let's say, situation in which maybe the clinical results might be, let's say, less solid because there are subjective scales or things like that. So, and with that, we also see overall, and then we can discuss about the subgroups again, we see approximately a 30% reduction in the neurofilament levels, which is so far the first trial that demonstrates that upon treatment with a drug, CIDP patients decrease the neurofilament levels. There are other cohorts out there that are, let's say, academic cohorts, but in a trial and a clinical trial, this is the first time that this is shown. And the important thing is that this happens again regardless of the type of CIDP, which means that there is a consistent effect independently on the baseline features of the patients.